Dr. Camp, thanks for being with us today.
Of course, of course.
I want to start off just with a basic question. Can you tell our audience what exactly is classified as a dental emergency?
Okay. Obviously, based on the provider, it's going to change just a little bit. Every provider is going to have their own definition. My personal definition is anything that's causing pain, generally greater than a level 5. Not just a small irritation or annoyance. We want, usually it's infection or tooth pain, fractured or broken tooth, any kind of fall that a patient might have if they've hit their teeth or the face in that area. Most of the time our emergencies have been based on cavities that have gotten larger over time, and they are encroaching on the nerve canal, causing severe pain with that patient. There are some emergencies with, for example, orthodontics, where you have a wire sticking out and really irritating the area, something that could cause a more medical emergency in the future if you don't address it at that time.
So help us understand why you're limited to dental emergencies only right now.
Right now, Governor Abbott, he put out an executive order basically stating that we are not allowed to see patients that are non-emergent. Basically, we're allowed to do urgent and emergency dental care at this time, no elective dental care at this time, because we're trying to minimize the transmission of COVID-19. Especially in the dental office, we have aerosols in the air. We want to make sure that our patients are safe and that we're safe as providers as well.
Fantastic. And during the last 4 or 5 weeks since the shelter in place has come down, what is primarily the cause of, or what type of procedures have you seen yourself doing the most of?
So we've had mainly limited exams, so we focus on the area that the patient's having the most pain in. We've been doing quite a few extractions and root canals, so where the nerve is affected. There have been a couple patients that have fallen or had some kind of trauma, so we've been able to treat them as well if they have a fractured tooth. Or say like a crown comes off and the patient's really having a lot of pain or a lot of irritation, any kind of abscesses. Those are our most common emergencies, usually from larger cavities or fractured teeth.
Perfect. And one last question. Are you guys taking any additional precautions safety-wise to keep yourself safe and the patient safe?
Yes. So the good news is the dental office, we're already germaphobes, right? So we already are doing a great job using our hospital-grade disinfectant to clean the rooms. We already use personal protective equipment. However, we are modifying a little bit into trying to protect ourselves with the aerosols. So we're using a safeguard in place in the rooms. Instead of just our normal suction, we're trying to implement the use of it's a tongue protector and additional suction device. We are also using face shields to help stop the spread of aerosols. We're having head covers, to protect, keeping us safe from going home with aerosols or droplets in our hair or clothes. We're also, most of us are changing our clothes before we leave the office. We bring a change of clothes so that we're keeping ourselves safe and the ones we love at home safe. For our patients, we're doing pretty much the same things. We just are making sure we're more thorough in cleaning the lobbies, the door handles, remotes, anything that is not normally disinfectant at the same rate.
That's perfect. Thank you, Dr. Camp, for your time today.
Thank you.